from the American Academy of Pediatrics.
Cheerleading is a year-round activity for millions of young people who spend hours each week practicing tumbling, jumps, and stunts.
New policy from the AAP urges high school sports associations to enforce safety guidelines and recognize cheer as a sport.
However we decide to define it, we can all agree upon cheerleaders require an amazing amount of skill, and the sport itself requires an amazing amount of athleticism.
Plus, new research shows how pediatricians can connect families to government nutrition programs.
Families said in many ways the pediatrician's office is a place where we're more comfortable, where we feel less stigmatized than a county assistant's office or a WIC office. So it'd be great if we could come there and get connected to these benefits.
These stories and more on Pediatrics on Call, the podcast on children's health from the AAP. I'm Dr. Joanna Parga-Valinki.
And I'm Dr. David Hill. This podcast is for everyone in the medical community, keeping our children healthy and safe.
It's a show by pediatricians for pediatricians.
But anyone who cares about kids will get a lot out of it as well. Let's start today's episode with a conversation about cheerleading and how to protect young athletes from injury.
Sometimes when I think about my high school career, I wish I could go back and be a cheerleader in it.
I mean, if you think about it, aren't you currently a cheerleader for all of our pediatric colleagues? I mean, go us!
No, David. I wish I could have been a literal cheerleader, doing flips, making a pyramid of bodies, and supporting sporting events at my school, that kind of cheerleader. And I see so many more movies and TV shows with cheerleaders in them that it gets me nostalgic.
Actual cheerleading. Now that it's a sport in and of itself, I find myself wondering, why aren't there cheerleaders for the cheerleaders? Regardless, it is a growing sport.
Is it a sport or more of an after-school activity? I know who can help us here. Give me a C. Give me an A. Give me an N. Oh, okay. I'm not a cheerleader. Just give me Dr. Greg Canty, the lead author on a new revised policy statement, Safety in Cheerleading, Epidemiology, and Recommendations.
Dr. Greg Canty is an associate professor of pediatrics and orthopedic surgery and medical and fellowship director of the Pediatric Sports Medicine Center at Children's Mercy, Kansas City. Dr. Canty, welcome to the show.
Thank you all very much for having me and a very generous introduction. And I like that cheer. I think you have potential as a cheerleader, Joanna. That sounded great.
Thank you so much. We can talk about that offline. I was sort of asking about this a minute ago, though, but is cheerleading considered a sport?
That is a great question, and one that I think a lot of people ask. And I think it really depends on how you define a sport. And I think that if you talk about cheerleaders, there's one thing we can say for sure, is that cheerleading requires amazing athleticism. And I think that's the one thing I hope all pediatricians and families listening can appreciate, is however we decide to define it, we can all agree upon cheerleaders require an amazing amount of skill, and the sport itself requires an amazing amount of athleticism.
How many people participate in cheer?
The numbers are sometimes difficult to come by. I think probably some of the best numbers come from the Sports and Fitness Industry Association. And if you take a look at their numbers and the numbers that we use for the policy statement, they estimate in 2022 there are about 3.5 million participants in cheer. Now, that's a little slightly down from some of the numbers they had in 2016. We think of cheerleading as a growing sport. And I think the thought is that those numbers may have dipped a little bit just due to the pandemic. And so I think it'll be interesting to watch over the coming years if cheerleading has hit a plateau, or if it's like what many of us suspect, it's going to continue to grow. But regardless, we're talking about somewhere between 3.5–4 million participants are estimated. And when you talk about pediatrics, we have to acknowledge that almost all of those participants are between the ages of 6 and 17 years of age. So they're right in our wheelhouse. There are some college participants, and just in case Joanna, you and David are interested, there's even some adult cheer groups that they're out there, but I think those are small in number. So there is still an opportunity if you're still wanting to be that cheerleader. So, but most of those are going to be right there in our pediatric wheelhouse between the ages of 6 and 17.
Greg, I know traditionally when somebody says cheerleader, an image of a female pops up in my mind, but one of my old bosses, actually, who's now retired, was a male cheerleader decades ago. So I know they exist. What's the gender split?
You might be fascinated to know that cheerleading started as a male-dominant sport, a little different than what we think of in 2024. And if you go back to the late 1800s when cheer first started, if we think about it, it started actually at the University of Minnesota, is where we start up as the formal cheerleading. And during the course of a game, there used to be scattering of cheers throughout the crowd, but all of a sudden, a young Minnesota student jumped over the fence, grabbed a megaphone, stood out in front of everyone, and started leading them in cheers. And that was basically the birth of cheerleading as we know it today. And so all the way up until World War II, cheerleading was basically very male-dominated. They were thought of as Yale leaders. And as I did kind of my historical dive while writing this policy statement, I began to find out that in the late 1800s and early 1900s, a lot of documentation said that there were two really prestigious positions on campus. It was the quarterback of the football team and the Yale leaders. And so those two carried significant weight and kind of, they had their own little persona walking around campus. And so I think some people are really fascinated by that. Then as you went through World War II, where a lot of things where males may have been off fighting the war, women came into play much more so in the sport of cheer. And after World War II, it really kind of evolved into a much more female-dominant sport. If you look in 2024, the latest numbers would suggest anywhere from 97 to 98% of participants are female. Now, there are males, and the male ratio increases a little bit in the collegiate ranks, but the vast majority of what we're talking about are young females when we're talking about the sport of cheerleading. And if you like trivia, you might be really fascinated to know that that young male student that jumped over the fence in Minnesota to basically give birth to the start of a cheerleading, would you and Joanna like to take a guess at what he was studying?
Biology?
Orthopedic surgery.
No. His name was Johnny Campbell, and he was actually a medical student. And so the birth of cheerleading happened among one of us, a medical student at the University of Minnesota, gave birth to the sport of cheer.
Since we're all pediatricians here, let's talk a little bit medical about cheerleading. What types of injuries do cheerleaders tend to get?
When you talk about injuries in the sport of cheer, we'll probably break it down into a couple categories. Most of them probably don't come as a surprise. A lot of the injuries come from falling and are oftentimes sprains of a ligament, muscle strains, or a broken bone, a fracture. But one of the things we found out in this updated policy statement is really the rapid recognition, I like to say, of concussion in the sport of cheer. That's probably one of the bigger changes since this policy statement was first written back in 2012 and reaffirmed in 2021. One thing that I believe got some attention with the earlier policy statement in 2012 was catastrophic sports injuries, which is really kind of housed at the National Center for Catastrophic Sport Injury Research, which is it's actually at the University of North Carolina. And what they do is they monitor kind of injuries that occur that they consider catastrophic across the country. And that's really any severe injury that occurs during the participation in a school or college-based sport. They try to break those out to determine were they fatal, were they non-fatal but had a severe or permanent disability, or were they severe but without a permanent disability. And they try to decide were they direct trauma or was it more from a medical or exertional thing like heat stroke or cardiac events. I think I got asked a lot about this over the years. And when you take a look at it, I think those numbers are hard to compile. They've done a great job of tracking down the catastrophic injuries, but we don't really know the true denominator. We get some of our information about the number of participants from the Sports and Fitness Industry Association that we mentioned earlier. But what we'd really like to get is better numbers from our state sport associations to know the true number of participants. And we don't really know that because only 31 states recognize cheer as a sport or student activity. So that may mean there's 20 sport associations out there when you include DC that aren't reporting these numbers. And so that underestimate of the number of participants really leads to an overestimate in the risk of catastrophic injury.
So when cheerleaders do get injured, on average, how long does it take them to return to participating in cheer?
We talked a little bit about the types of injuries. I think it's important to note the injury risk associated in cheer. This was something I was fascinated by. I should mention, I was not a cheerleader myself. And so as writing this report, I had a co-author, Jen King from Hawaii, who was a wonderful resource and much more of a technical expert than I could ever be. She was actually a professional cheerleader when she was in medical school and actually worked as part of the Philadelphia Eagles and the Philadelphia Soul. So she was a great resource. We talked a lot about this. And when you go back and take a look at the injury risk in cheer, it's actually, if you take a look at numbers that are reported to the NFHS, which is the National Federation of High Schools, cheer itself, there was only one girls' high school sport who had a lower risk of injury, and that was girls swimming and diving. And so when you compare it to
I thought you were
like,
going to make us guess, and I was going to say bowling.
Bowling? Well, that could be a great answer. So I don't remember seeing bowling actually on the table, but you may be onto something there. But when you take a look,
because bowling is on the floor.
Very good, very good. But if you take a look at that, they like to use a term called athletic exposures, which an athletic exposure counts as a practice, a competition, or any time there might be a chance of injury. So if you look at the overall injury rate in cheerleading per 1,000 athletic exposures, it's only going to be 0.71. And that's pretty low. When you compare it, I think swim and dive was 0.32. And then if you take a look at some of our popular sports, such as soccer, was almost 3 times that at 2.46. And girls basketball was right around 2. And so I won't worry a whole lot of numbers on a podcast, but I guess the point I like to make is the actual injury risk in cheer is much lower than many other activities that folks participate in. But as David alluded to, when injuries do happen, they do have a tendency to have a little bit of severity. And we talk about following a cheer injury. When you look at data from what a published study in pediatrics, it said about 34% return in less than 1 week. 41% return anywhere from 1 to 3 weeks after an injury, and 11% actually take over 3 weeks before they can return and get back to cheer. Now, the vast majority of those injuries that really take a long time seem to be related to concussion and to fracture and injuries. And there's even a small number that are disqualified for the season. Those disqualifications for the season are usually the results of fractures or joint dislocations. But as we talked about, cheer is a relatively safe sport, but when injuries do happen, we need to be aware that some of them may be severe.
And cheerleading used to be tied to other sports, but now it functions independently and it happens all year round. So when do cheerleaders need to see their pediatrician for a physical?
Well, we encourage cheerleaders to all have a pre-participation evaluation in a PPE. And you are correct that, as we've kind of talked a little bit about cheer on this podcast, I think it's important, as I guess I'm starting to classify myself as an older pediatrician now. Sometimes when I look back in cheer, I think of it as a very traditional sideline in support of another sporting event. And that's sometimes what we kind of think of as scholastic cheer. Occasionally they compete against other schools. But cheer's really grown significantly to involve other disciplines. And a lot of that has to do with all-star and club cheer, which emerged back in the 80s and 90s when all of a sudden, on ESPN, you could watch a cheer competition and see all these amazing athleticism that oftentimes these young ladies and young squads across the country had, and started creating this whole kind of culture around all-star and club cheer, and that's grown significantly. And as a result of that, cheerleaders are competing year-round, and whether you have that PPE in the spring and the fall probably doesn't matter to me as much as you have a PPE on a regular basis to talk about some of the things we've talked about today of the risk, expectations of cheer, and some of the extra things you should be thinking about or discussing with your young patients.
And Greg, given the breadth of this activity, it can be so many different things. How do pediatricians know their patients are getting the right training and are in the right types of cheer programs for their skills?
Wow, that is a tough question. And I think probably bringing up the conversation is important topic number one. And in the paper, we talk a little bit about, we've spoken a little on this podcast about, is cheerleading a sport or is it not a sport? That's why we make the recommendation that all high school state sport associations recognize cheer we encourage them to recognize cheer as a sport or activity that has oversight. As a result of that, if you're competing in more of a scholastic cheer type activity, we can then anticipate that they're getting the same training, the same oversight, the same safety recommendations that go into all sports. If it's not a scholastic category and you're competing outside of that, maybe in a club team or a gym, then there are excellent guidelines out there. Really, the governing body in the U.S. is USA Cheer, USA Cheer publishes excellent guidelines talking about that. And I would encourage my families that are participating to talk to their club, see if they're a member of USA Cheer, if they follow their guidelines for competitions, training. And the one thing we talk a lot about is that skill progression. Having trained coaches really helps recognize is that when can I move up to the next skill? When can I progress up the ladder? We know we all like to be great instantly. And so you want to make sure that if you have a young cheerleader, that they're advancing and they've established the base of skills that they need to go and rise up to the next level. And that requires qualified coaching.
This has been such a cheerful conversation, Greg. Before we let you go, any last takeaways to pep up our listeners so they cheer for you the next time you come on the podcast?
I think my message to pediatricians would be that I would strongly encourage you to educate yourself on the sport of cheerleading and the athleticism that it requires, trying to get your community aware of following guidelines on safety that are published by the USA Cheer, and encouraging your high school sport associations to recognize cheer as a sport and activity. And then really to make the best use out of your pre-participation evaluations by talking with families, again, about the relatively excellent numbers on how low injury rates are typically with cheer, but also warn them that injuries do occur. And if they do occur, make sure that they seek out proper guidance on when to return from a cheer-related injury, when to return from a cheer-related concussion, and really just, educate ourselves as pediatricians about how valuable this sport is to our young audience and help us take the best care of them in the future. And I hope that's what this paper does. I hope it really helps people be better prepared to care for the young cheerleaders in their office.
Well, I think it is an impressive paper. I hope everybody's going to read it. And I just have to say, thank you, Dr. Greg Canty. Thank you, Dr. Greg Canty. Everyone, no? Well, it was a pleasure to have you with us today.
Joanna, David, I'd like to thank you all very much. And that is probably about as warm as a send-off as I'm ever going to receive in life. So thank you very much.
To read the policy statement, safety in cheerleading, epidemiology, and recommendations, visit our website at aap.org/podcast.
Coming up, we'll look at how we can help families access government nutrition programs. David, one thing I always do when I'm discharging a patient from the NICU is ask if the family would like to receive WIC.
It's funny, we call it WIC, which means Women, Infants, and Children, when the full name is Special Supplemental Nutrition Program for Women, Infants, and Children.
Also, while WIC does offer lactation services, it's really food for the whole family, so maybe we should call it FIC. These program names can be a real mouthful.
I thought you were going to mention SNAP there, Joanna, which is a little bit of a snappier mnemonic for Supplemental Nutrition Assistance Program, but I don't disagree. Just getting through these acronyms is a grind. Imagine accessing these services. How hard can that be?
Sometimes, even when we recommend them to families, these programs can be a challenge to access. That's what the authors of the Pediatrics article, Caregiver Perspectives on Improving Government Nutrition Benefits Programs, really wanted to understand. Here to discuss that paper is senior author Dr. Aditi Vasan.
Dr. Vasan lives and works by you, Joanna. She's an attending physician at the Children's Hospital of Philadelphia in the Division of General Pediatrics and holds a Master's of Science in Health Policy Research from the University of Pennsylvania. Aditi, welcome to the show.
Thank you both so much for having me.
David and I mentioned WIC and SNAP, but can you help us define what those programs are?
Happy to. So WIC, or the Special Supplemental Nutrition Program for Women, Infants, and Children, is a nutrition support and nutrition education program for pregnant and postpartum people and for infants and kids under the age of 5. And WIC provides families with money that they can use to buy healthy foods. And then also, really importantly, as you mentioned, Joanna, provides nutrition education, including breastfeeding support for new moms. SNAP, or the Supplemental Nutrition Assistance Program, is a program that provides funding to buy food for low-income families, including children and adults of all ages. And both WIC and SNAP are evidence-based programs. So there's research to show that kids who receive these benefits have lower rates of low birth weight and preterm birth, lower rates of food insecurity, and improved nutrition.
And of the families who are eligible for these benefits, how many are accessing them?
That's a great question. So for WIC, we know that about 6 million people across the country get these benefits, but about twice that number are eligible. So only about half of all families who could get WIC actually get these benefits. For SNAP, we know that about 20 million households and 44 million or so people in these households get SNAP benefits, and that the participation rate is around 80%. So definitely higher than WIC, but still with room for improvement, with about 20% of people who are eligible not getting those benefits.
And then for your study, you interviewed families who had engaged in or were currently accessing WIC and SNAP. How did you come up with the questions for these interviews?
We were really thinking about this in terms of what they sometimes call user-centered design or human-centered design in the tech world. We wanted to understand from families, we know that the way these programs currently are isn't the way they should ideally be designed. So what is working for you? What isn't working for you? And how could these programs be improved to make them better? And as a pediatrician, we were especially interested in thinking about how these programs interface with the pediatric healthcare system and how connections between pediatric healthcare and WIC and SNAP could be made stronger.
When you spoke with these caregivers, what themes came out of those interviews?
Yeah. So for WIC, we heard three main things. First, we heard that families really appreciated all that WIC provided. So they appreciated that WIC gave them money to buy healthy food for their kids and sometimes to make healthier choices than they could otherwise. We know that eating healthily, choosing whole grains, choosing fruits and vegetables can sometimes be more expensive. And so people really liked that WIC gave them money that they could use specifically to buy those healthy products. Families also really appreciated the breastfeeding support and the nutrition education that they got through the program. But we also heard about some WIC challenges. Specifically, a lot of parents told us that it was really hard to identify WIC-eligible products in store. As you guys might know, WIC often has restrictions on which specific brands of food or types of food you can buy with your benefits. And as a result, it can be hard for families who are in store to figure out, is this a covered product or is this not? Related to that, a lot of families said it was sometimes stigmatizing or embarrassing for them to use WIC benefits, especially if they got to the checkout line and then found out that something they thought was going to be covered actually wasn't. For SNAP, some of the things that we heard were that people actually really appreciated the variety of things they could buy with their benefits, and they could really choose to spend it on whatever kind of food they and their children like to eat. But in terms of barriers, we heard that SNAP's income limits could be a barrier to participating. A lot of families said sometimes if you earn a little bit more money because you work overtime or you get a small raise, you become no longer eligible for benefits, and that can result in you actually having a net loss of income and not being able to have as much money to pay for food week to week. We also heard that the recertification process can be a pain for families. Sometimes they would lose their benefits without knowing why because they didn't submit a form or fill out some paperwork, often paperwork they didn't even know about. So we heard about those as pain points for both programs.
And did the families you interviewed help you identify ways to make accessing WIC and SNAP maybe a little bit easier?
Yes, we heard a lot of great suggestions from the families we talked to about ways to make it easier for them to connect with WIC and SNAP. First, families talked a lot about allowing online or phone-based enrollment. We know that these days a lot of us buy our groceries on the phone, use apps to guide a lot of the things that we're doing. And so families said that it would be easier for them to connect with WIC and SNAP if they could fill out applications online. A lot of families also had great things to say about the WIC Shopper app, which is something that's available to WIC beneficiaries in most states, where you can actually have an app on your phone and scan products in store to find out if they're eligible, which can make it much easier than having to look at a brochure and try to figure that out on paper yourself. So people really wanted technological innovation, including online enrollment and apps to help them participate. The second thing we heard was about reducing stigma associated with participation. People sometimes described how in the application process, they were made to feel like they were less than or they were inadequate in some way for needing to get these benefits. And that was really tough to hear. And I think something we should be working to change because families should be able to access these benefits without having to feel bad about themselves. And the third thing we heard that was especially important to us as pediatricians was about improving coordination with healthcare systems. We heard this in two ways. First, families said, please use your pediatric encounter with us, especially in primary care, as an opportunity to connect us with benefits. Families said, in many ways, the pediatrician's office is a place where we're more comfortable, where we feel less stigmatized than a county assistant's office or a WIC office. So it'd be great if we could come there and get connected to these benefits. The second piece we heard was that sometimes WIC visits can feel redundant with pediatrician visits. We know that some of the same things we do at our visits, like get someone's height and weight checked or measure their lead level or hemoglobin, are then redone at the WIC office when they go a week or two later. And so some families said, that doesn't make a lot of sense to me. Can't you guys just talk to each other so that this process doesn't feel quite as redundant and disjointed to us?
You know, I'm just gonna add to that. That's my experience at the health center where I work, is that frequently it appears the kids have not had hemoglobin and lead, but we never recheck it until we have called the WIC office and requested their labs, because they've often gotten to it before us. This has given me a lot to think about when I refer to these problems. Do you want to leave our listeners with one more takeaway about your study?
Sure. I would encourage everyone listening to think about how they can connect families in their practice to WIC and SNAP. And there are great resources that you can look to. The National WIC Association, which is the WIC equivalent of the AAP, often has information about WIC programs in your area. And your state chapter of the AAP might already have relationships with some local WIC organizations and community assistance organizations that you can rely on to help support these connections. There are a lot of different ways to implement connection to benefits in practice. Here at CHOP, we've started asking families at their primary care visits, are you already connected to WIC or SNAP? And if not, would you like to be? And then we actually have a resource navigator who can call families and follow up and really help them navigate some of the complicated stages of that process. There are also some other really interesting models happening across the country, including electronic health record integrated WIC referrals and information sharing of things like that lead level and hemoglobin, as well as having co-located WIC visits and primary care visits, which obviously is the most convenient thing for families. So there are a lot of different ways to think about what this could look like, but I'd encourage everyone to think about getting families connected to WIC and SNAP whenever you see them.
Dr. Aditi Vasan, thank you so much for joining us today.
My pleasure. Thanks so much for having me.
To read the article, Caregiver Perspectives on Improving Government Nutrition Benefit Programs, go to our website at aap.org/podcast. At the end of every episode, we like to leave you with something positive or enlightening. We call this segment Say Ah. David, what's your Say Ah this week?
All right. Last year, on a total whim, Christy went out and bought a mandarin orange tree and stuck it in the middle of our backyard. And I thought, we're in North Carolina. It's not like my sister who lives in Phoenix who can grow all the citrus without any effort. This is not going to work. Joanna, we have got, she counted them, 54 perfect mandarin oranges that are insanely sweet. And the only thing is, I'm kind of guarding them jealously. We really need to bring a couple over to our neighbors. And I'm like, no, my oranges. But
how many can you eat in a day, David?
I'm going to share 52.
Yeah, so I'm like, ship some over. No, you should give them to your neighbors. That sounds fun.
And what's going on with you?
My Say Ah is about my son, Simon. I was watching a football game with him because he's become an Eagles fan. That's just a byproduct of him living in Philadelphia. And I was like, Simon, I really don't want you to be a football player when you grow up. I'm hoping that you'll choose something else. And he goes, no, Mommy, no, I'm not going to be a football player. I was like, okay, so what are you going to do? And he thinks about it and he looks at me and he goes, Mommy, I'm going to be a teacher. Oh, I thought it was so sweet. And I wanted to say that on the podcast so I remember.
Oh, that's great.
Yeah.
I just love Simon more every time you talk about him. What a sweetie. That's it for today's episode. If you like Pediatrics on Call, please subscribe on your favorite podcast app and help us spread the word. Follow us on Facebook, Instagram, and YouTube at Pediatrics on Call.
Pediatrics on Call is a production of the American Academy of Pediatrics. Our producer and editor is Ann Johnsos. Our audio engineer is Doug Nagel. Joe Puskars is our associate producer. And Susan Martin is our executive producer. Our theme music was composed by Matthew Simonson. We're off next week due to Thanksgiving, but we'll be back after that with the December edition of First Up.
We'll talk to Dr. Lewis first about what pediatric gifts are under his tree. I'm Dr. David Hill.
And I'm Dr. Joanna Parga-Belinkie. Thank you so much for listening.